Hi, this is the continuation of a series of videos designed to give individuals information that they can use to prepare for a visit to a physician. The videos are designed to help ensure that the individual can ask appropriate questions of the physician and to increase the likelihood that quality care is delivered. Anorectal problems are another common complaint seen in primary care offices. They cause a high degree of anxiety in the patient because the patient is concerned about cancer being the cause. Anorectal complaints include pain, lumps, including anal cancer or rectal cancer, discharge, bleeding and itching. Causes of rectal pain can be an anal fissure, anal herpes, ulcerative proctitis, Proctalgia fugax, rectal ulcer, hematoma, hemorrhoids, and abscesses. An anal fissure is a small tear in the thin, moist tissue that lines the anus. An anal fissure may occur when you pass hard or large stools during a bowel movement. Anal fissures typically cause pain and bleeding with bowel movements. Anal fissures can cause bleeding with bright red blood spotting the toilet tissue. If the physician finds multiple fissures, the physician will consider Crohn's disease as a possible cause. Treatment may consist of high residue diet, high fiber diet, and the avoidance of constipation. Recurrent fissures may require surgery. Proctalgia fugax. Proctalgia fugax is a functional anorectal disorder characterized by severe, intermittent episodes of rectal pain that are self-limited. The diagnosis of Proctalgia fugax requires exclusion of other causes of rectal or anal pain. The pain is fleeting, but can last for up to 30 minutes. It can awaken one from sleep. It affects adult males primarily. Treatment is assurance and explanations. Solitary rectal ulcer. A solitary rectal ulcer is a rare condition and often occurs in people with chronic constipation. Solitary rectal ulcer syndrome can cause rectal bleeding and straining during bowel movements. The physician will do a sigmoidoscopy to assist in diagnosis. The ulcer can resemble cancer, which must be ruled out. Treatment includes a high fiber diet and the avoidance of constipation. Perianal hematomas. A perianal hematoma is a purple tender swelling at the anal margin caused by a rupture of an external hemorrhoid. Not all perianal hematomas require treatment. However, because of severe discomfort, some need to be drained or removed during a simple in-office procedure. If a blood clot has formed, the physician will need to remove it. The physician will require the patient to follow up in 4 or so weeks in order to examine the patient for internal hemorrhoids, which will predispose further reoccurrences. Perianal abscess. A perianal abscess is a painful condition in which a collection of pus develops near the anus. Most perianal abscesses are a result of infection from the small anal glands. It often appears as a painful boil-like swelling near the anus. Surgical incision and drainage is the most common treatment for all types of anal abscesses and is usually successful. About 50% of patients with an anal abscess will develop a complication called a fistula. A fistula is a small tunnel that makes an abnormal connection between the site of the abscess and the skin. Anorectal lumps. Anorectal lumps cause a high degree of anxiety because of the fear of cancer. Sometimes anal cancer causes no symptoms at all, but bleeding is often the first sign of the disease. The bleeding is usually minor. At first, most people assume the bleeding is caused by hemorrhoids. And again, hemorrhoids are painful swollen veins in the anus and rectum that may bleed. Hemorrhoids usually are benign and are fairly common cause of rectal bleeding. Important symptoms of anal cancer include rectal bleeding, rectal itching, a lump or mass at the anal opening, pain or a feeling of fullness in the anal area, narrowing of stool or other changes in bowel movements, abnormal discharge from the anus, swollen lymph nodes in the anal or groin areas. Most often, these types of symptoms are more likely to be caused by a benign, non-cancerous condition, like hemorrhoids, anal fissures, or anal warts. Still, if you have any of these symptoms, it's important to have them checked out by your physician so that the cause can be accurately determined. I have a longtime female friend, known for over 4 decades, who was diagnosed with late-stage anal cancer. She had to undergo surgery, radiation, and chemotherapy, but her cancer did not disappear. She is constantly battling for survival. She's a remarkable woman. I often wonder why the cancer was not picked up during her annual gynecological appointments. A simple digital rectal exam during a gyne appointment might have caught the cancer before it spread. So, if you think you are not getting thorough and quality care, then please demand it. Well, I hope this helps. Have a good day.